कनक न्यूज रो हेल्थ कॉन्क्लेव रे जोगते अंकोलॉजिस्ट गारिमा सरावगी कौन कहिथिले
आमे केमती जानबू जे मते कैंसर होईची फर्स्ट स्टेज होईची कारण अनेक लोकंकर डिटेक्शन फोर्थ स्टेज रे होची मैडम आ से माने जानि नाहंती तांको जीवन रे फर्स्ट स्टेज पळेलानी सेकंड स्टेज पळेलानी थर्ड स्टेज पळेलानी सेहित पई डर बेसी भी बढ़ुची
I would not agree with you completely on this. I'm really sorry.
Again.
But many people, even poor people, uneducated people, से मानो actually जानू छंती तांकर कोनो problem होची. Breast लो lump अच्छी से भय करू छंती cancer अच्छी से पई डॉक्टर पखर आसुना हंती.
Okay.
I'm going to the camp. A patient comes to me and she tells me कि मैडम मोते probably cancer हेची. मु तो मरी जीबी. Treatment करी कि कौन करी भी. It is better that I die. At least my family members will not have to spend money on my treatment.
Okay.
So that is the biggest problem here. Not only Odisha, everywhere else. That to basic about a problem. Despite of all the awareness, people know today, and the lifestyle changes that is happening. All these things are actually contributing. But we tell stop alcohol, stop taking tobacco, stop smoking. Most of the people who are doing these know the consequences. Most of them, even uneducated people. So despite of telling them to completely stop, I tell them, and it is also recommended, to limit the alcohol consumption, to limit the smoking. Definitely it is not good. But when we tell them to stop, they never stop. When we tell them to limit, they definitely ask, what is the limit that is acceptable? So gradually when the consumption decreases, when the lifestyle improves, as sir told, people become more and more aware of it.
मैडम संक्षिप्त रे गोटे कथा जानिबी फर्स्ट स्टेज रु जनकर जदि कैंसर अछि सिम्पटम्स आरंभ हे जाय ए कथा सत
yes
डॉक्टर को देखेबा दरकार
yes so there are 5 मु कहउतिली आपन को there are 5 signs which should be always raising an alarm in the head of any person, which may or may not be exactly signs of cancer, but cancer could be there in the body.
Okay. डॉक्टर को देखेबा दरकार से पांचटी साइन जदि
Those
कहि देबे
5 signs.
हम दर्शकों को पई बहुत भलो हबो.
Yes, I'll be. So first sign is unexplained weight loss or loss of appetite. से किछि भी कारण रे weight loss होछि और appetite loss होछि, but कारण जाना नहीं. Most of the people tell मोते कामरो stress अछि, मोते tension हेछि, से पई weight loss हेतिबो, but no. Second is any unnatural bleeding from any of the orifices. Jemti female have menstrual bleed, that is a natural bleeding. Any unnatural bleeding from any orifices of the body should raise an alarm of that. Any lump or swelling in the body anywhere should raise an alarm for cancer. Any person who's having unexplained fever for a very long time, usually this kind of fever may have a background of cancer. And as sir told, any alteration in the bowel or bladder habits. So any cancer starting from mouth to the anal canal will have some alteration in the bowel and bladder habits. A simple gastritis, which is for longer term, may have harboring stomach cancer. A simple constipation will have stomach cancer. So these 5 signs and symptoms, if anybody is having anywhere, they should at least once show to a specialist doctor who can diagnose them. Another problem that is here is people are going to the doctors also, but they're not going to a gastroenterologist for a stomach problem. They're going to a general medicine person who is ignoring or not able to diagnose it. They're not coming to a surgical oncologist or an oncologist.